Hello, my name is Helfi and go to the world and exercise. Exercise 24. Master to part of the sentence. In 1988, saw the UK launch so live at 20 of measles, mumps, and rubella and an L vaccine. Chickenpox, varicella is the common infection disease of the childhood. Rabies has an incubation period ranging from 4 days to many months. The patient remained febrile with fever or temperature of till 9.5 degrees. It was admitted without the history of influenza type. Symptom was fever with rigor, malaria, and general malaise. Quite a proportion of patients who recovered from hepatitis B becoming carriers of the virus. The central part of Africa is in the midst of an epidemic of AIDS. Measles rubella is the most infection during the catarrh stage. Lyme disease is caused by transmission of B-point bulldozer from animal to man by isoditis. PUO stands for pyrexia of unknown origin. Exercise 2. Compare case report of the patient in the A opposite. On examination, he looked unwell. His pulse rate was 100 per minute. He had a pain spleen. The combination of fever and rigor in the patient who had recently returned from Africa strongly suggest a diagnosis of malaria. The incubation period is usually 10 or 14 days. In his case, the patient admitted he had not been talking prophylaxis regularly. The diagnosis was confirmed by presence of parasites in his bloodstream. Exercise 3. Complete a sentence. An infection which can be treated safely while antibiotic is curable. Another word from an epidemic is an outbreak. Bacteria and viruses are examples of microorganisms. Someone whose temperature is normal is a febrile. The common infection with Epstein virus is known as glandular fever. Unit 25, Exercise 1. Complete a table with from for E, C, D, and E opposite. The noun and adjective. Affect, affected. Anxiety, anxious. Behavioral. Dementia, the mirror. Disturbed. Suicide, suicidal. Exercise 2. Make word combination using words from the each book. The word can be used twice. Behavioral syndrome, eating disorder, major depression, mental retardation, personality disorder, psychomotor retardation, sleep disturbance, sustained abuse. Exercise 3. Complete a sentence. The way a person behaves is his or her behavior. A persistent emotional state is a mood. A sudden attack of anxiety is a panic attack. The form of dementia associated with aging is called senile dementia. a disorder which is not associated with pathological change is functional. An idea which forces a patient to repeat unnecessary action is a compulsion. Exercise 4. Which symptom of depression was each patient suffering from? Case 41. A 56-year-old man or woman presenting of the GP complaining of increased tiredness over the past 3 months. She had lost interest in the most thing. She was sleeping poorly and tended to wake up early. But any suicidal tendencies. She was tilted and was pacing unit more often. She was eating normally and her weight was steady. The depression symptoms are tiredness, lost interest in the most thing, and sleeping poorly. Exercise 26. Complete a table with words from A, B, and C opposite. Adjective and noun. Blind, blindness, conscious, consciousness, daft, daftness, dizzy, dizziness, numb, numbness, lightheaded, lightheadedness, unsteady, unsteadiness. Exercise 2. Make word combination using a word from the ebook. The word vision, epilepsy, feed, promoter, symptom, syncopal, attack, urinary incontinence, visual acuity. Exercise 3. A doctor is trying to determine the cause of the lost consciousness in the 52-year-old man. Complete the doctor question. Did you lose consciousness suddenly or gradually? Did you get a warning of the attack? What were you doing before you passed out? Were you walk or under any street at the time? Did you feel dizzy or lightheaded before the attack? Did you lose control of your bladder? Did you notice any involuntary moment while you were unconscious? Unit 27. Complete a table with words from A and B opposite, noun and adjective. Accent, accent, diminution, diminish, placidity, placid, spasticity, spastic, wasting, wasted. Exercise 2. A doctor is giving instruction to a patient during examination of the motor system. Identify what the doctor is assessing in each case. I like you to relax. I just going to move your arm up and down. Move your tongue. Can I see your hands? Muscle board and involuntary movement. Now I go to staring you out. Try to stop me. Power. Can you touch my finger with your and then touch my nose? Your nose. Good. Now do it again with your eye closed. Coordination. Exercise 3. Complete a sentence. A flashy hand drew limply to to form a right angle with the grease. These reflexes are reflexes that are stronger than normal. Most laws wasting mean the motion is reduced in both. A T is a form of involuntary movement. A K is often used to the test of Vivink's response. His coordination was poor, the could not perform rapid alternating movement. A reflex handlement is used to test reflex when sometimes is diminished is less than normal. Exercise 4. A patient is brought to A&E income when her name is spoken. She opens the eyes, but she does not answer question or obey intrusion. What is her GCS score? GCS 5. I open it to speed equal 3, verbal response non equal 1, motor response non equal 1. Exercise 1. Complete a table with room for E, B, and C opposite and relative form where, non, and adjective. Q about, excite, excision, grow, crow, growing, invade, invasion, invite, side, obstruction, obstructive, ballet, population, apply, population, apply, spread, expanding, swelling. Exercise 2. The notes below are about the patient described in the B opposite. Use the sentence in correct order to the next paragraph of the case report. Here the disease. On examination, his temperature was 37.8 degrees. Here the tweet, there was a small fan 3/4 cm in mass in the right supraclavicular fossa. Here the 7, there was a length nose in the buccal and inguinal area. Here the 2, his mouth and throat were normal. Here his pulse rate was 100 per minute regular and blood pressure at 112 per 66. Here the 4, his cardiovascular and respiratory system were normal. The 5, on abdominal examination there was a mass plate 3 cm below the leg costal margin. The 1, examination of the central nervous system was normal. Exercise 2. Compare sentence. Distant spread of tumor cell is known as metastasis. Main symptoms of cancer such as difficult swallowing are due to obstruction. The opposite of painful is painless. A malignant neoplasm is called a cancer tumor with no invade or metastasis are benign. Secondary tumor are those which result from the spread. A primary cure is not possible. Papillary treatment should be given. A papillary label suggests metastasis. Unit 29. Exercise 1. Complete a sentence. A baby that is born and week before the EDD is premature. Termination of pregnancy might be necessary for medical reasons. The first 3 months of pregnancy are known as the first trimester. Fetal distress is the first stage of labor. Is an indication for cesarean section. It was breast presentation and delivery was by forces. Miscarriage is another term for spontaneous abortion. The cord was worn tightly around the baby's knee and it was unfortunately stillborn. Exercise 2. Complete a table with from each opposite. Verb and noun. Abort, abortion, delivery, induce, induction, miscarriage, miscarriage, present, presentation, terminate, termination. Exercise 3. Dr. Binet and SHO is presenting a patient a weekly meeting in the obstetric unit of the hospital. Complete the presentation with correspond as the verb from 29.2 above. If she is Clara Davis, she can to the antenatal clinic at night week. In the health past obstetric history, she had a pregnancy when she was 18, which was terminated, and another one a year later, which is spontaneous aborted. Since then, she has had 3 pregnancies. In the first, baby was delivered normally and the 14th week. In the second, she has an induction of labor till the 9th week because of fetal discharge. The third baby presenting a breast and was delivered by cesarean section. Unit 30 may exercise 1 make word combination using a word from the e-book. Blood, stand, breath, song, flower, fruit, prototype, call, vocals, resonance. Exercise 2. Write the question using words that are better known to patient. Number 1. If you call prototype, is a loose call. What colors in the sputum? What colors in the phlegm? Is even purulent? Is it even yellow? Have you ever had hemoptysis? Have you noticed any blood in it? Do you suffer from dyspnea? Any problem with your breathing? Exercise 3. All the following statements true or fake. Give reason for your answer using numerical knowledge. A. A patient who has lost cold produces pain. True. A cold is often described as lost. Crackers are held when the airways are narrowed. Fake. Crackers suggest the presenting of blood. A patient who has no produced cold produces a sputum. phase, a code might be no prototype. We see a typical of sclerosis phase, which is indicate narrowing of the airway. A pleural root is a sign of asthma phase. The sun hair when the pleural surface are inflated is pleural root. Unit 31, exercise 1. Complete the description of herpes-zoster symbol by replacing the medical word in brackets with ordinary English word. Symbol herpes-zoster usually start with pain and soreness. The three sport muscles appear that develop into a group of small blisters, vesicles over a particular area on one side of the body. In most patients, new spot lesions continue to appear for 3 to 5 days. The small blister vesicles become filled with pus, pustula, and they form scars. Cross. In severe cases, they might be scars, cicatrices, afterward. Exercise 2. Read the description of the rash and rubella and complete the notes. The spot are scarred pink muscles appear fit behind the ear and on the forehead. The rash spread rapidly fish to the trunk and they to the leg. Location and distribution: fish behind the ear and on the forehead, the trunk and the leg. Roping, scarred, dilation, muscle, color, pink. Exercise 3. Complete notes of the rash in the photograph and subject a diagnostic. Location and distribution: white spray on the chest and the abdomen, roping, scarred, dilation, small muscle with some scar, color pink. Exercise 4. Complete notes for the lesion in the photograph and subject a diagnostic. Location and distribution: below lateral angle on the left eye, roping single, type of lesion, nodule, color white and pink. Unit 32, exercise 1. Write the corresponding medical term for the ordinary English word and say what kind of fault is involved. Common word, medical term, and type of fault. Bruise, contusion, blown, cut, inside wound, child, grace, abrasion, blown, scrap, lineal abrasion, brown, star wound, penetrating, child, tear, laceration, blown. Exercise 2. Choose the correct word to complete the description of the injuries shown in the illustration. They are graces above the left eyebrow and on the left side of the knee, a contusion to the left side of the lower lid and tear to the left cheek. Exercise 3. Write a description of the injuries shown in the illustration. This is a laceration on the left shoulder and an inside wound occurred approximately CSE in the link about the network. Exercise 4. Complete a sentence. Requiring change of position are necessary in the immobile fascia to prevent the development of pressure sore. He has several star wounds in the abdomen from the knife. He was now incarcerated by a heavy blow to the head. The wound was only superficial and required no treatment. Exercise 1. Look at conversation in the opposite and complete notes about Mr. John. Use medical terms where possible. Frequency, noturia, dysuria, existence, strength, dribbling. Exercise 2. Match the patient description of the symptoms with medical terms. Number 1. I had to pee every half hour or so. B. Frequency. I get a candy pain when I pass water. Dysuria. I had to get several time to pass water at night. Noturia. I had to rush to go to the toilet. Urgency. I had trouble getting sedated. Hesitance. I can't hold my water. Inconsistent. I pass some blood in my urine. Hematuria. Exercise 3. Write the doctor question for each of the symptoms in day exercise 2. A boy. The frequency, how often is that? How often do you pass urine? Dysuria, do you get any burning or pain when you pass water? Noturia, do you have to get your night? Existence, do you have any trouble getting started? Inconsistent, do you ever lose control of your blood? Hematuria, have you ever passed blood in the urine? Urgency, do you have to rush to get to the toilet in time? Exercise 4. Describe the finding of the laboratory report in words. There was a trace of blood, gross proteinuria, and no gas. Unit 24, Exercise 1. A doctor is talking about a patient during a ophthalmoscopy. Match the underlying expression she used to expression with similar meaning. Right, Mr. Gore, because you've been having these hitches, I'm going to have look at your eye. Particularly the back of your eye, the retina. I'm going to put a couple of drops in your eye, which will make it easier for me to see the retina after a few minutes. You may think your vision a bit blurry. It's where we are all often about and all. I need to get rid of as much external light as possible. It means closing the blind. Now I like you to look straight here at the clock. It takes a few minutes and your eyes may feel a bit tired, so you can blend see here. You need to. I don't want you to look at me. Look at the clock. A. The examination is done with dimmed light. B. A topical brilliant solution. C. to aid dilation A. Fillets on a target D. Complete the instruction. Draw the curve. Place the diagram based on the point. Open the bar. Watching the first bar. The point is the diastolic blood pressure. You're exploring the flame and the diastolic blood pressure. Exercise 3. Complete a test. Phlebotomists are specially trained in taking blood. They are skilled at being puncture the vein to take a blood sample. The grease hand and foot can be used, but more often a vein in the inner part of the elbow is used. Here it is difficult to locate a suitable vein. The patient must be asked to make a fist or tourniquet might be applied on the upper arm to make the vein more apparent. Afterward, dressing is applied and the patient is asked to press gently. This helps to stop the bleeding and prevent bruising at the site. It's important that specimen tools are labeled correctly before they are sent to the hematology laboratory, where a full blood count or other investigation will be carried out. Thank you.